means, or if you're one of these young men who don't believe you'd ever need insurance because you're immortal, you're not going to have a very good experience typically in your average hospital. We've had folks get sent away from hospitals with acute injuries and illnesses that should have been in ambulances, because those are the very hospitals that have to garner their resources and protect those beds for people who can actually pay for them. And the young people I serve don't know about charity care, they don't know about their rights as patients, and so we have a lot of education to do as we talk to these folks. And you know, if they're already really distrustful of adults or people in uniform or people who are the experts or authority, they won't just take our word for it. We're going to have to work extra hard to earn their trust and their rapport, and that's one of the things I love about Teeth and Toes, because when you all come into the shelter, I introduce you to a homeless young person, and they look you up and down and they say, I don't know, Kristine, what is this going to be like? And I just say, oh, just give it a try. And they will often walk out of there kind of going, wow, that was really great. And I'll hear three comments. One is, wow, these medical students, they're really hot. Which always cracks me up. It's like, yeah, because most of the people who stay in my shelter are young men, 75% male. Okay. The other comment that comes up the most is, you know, I had no idea, blah, 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 blah. You know, like they learn something about their teeth, they learn something about their foot care, they learn something that they didn't know before then, and they feel empowered. They feel like, hey, I've got some information that I can use. And then the other thing I learned is, when are they going to be back? Because you guys are showing up maybe 2-3 times a year, and in the life of a homeless kid, that is not often. These guys think about what's going to happen today and tomorrow, and beyond that is too far away. So that's my invitation to come back as often as we can arrange it. So some of the things that is interesting, I heard earlier the idea that there's a lot of homeless people in Seattle. The bad news is there's a lot of homeless people everywhere. The good news is Seattle, unlike some cities, doesn't make a big effort to hide them. We don't try to like shush them under the carpet like other cities do. But yeah, we do have an epidemic, and it's nationwide. I remember a time where you could drive on the freeway and see nobody hanging out a sign on the overpasses and off-ramps. There was no homeless people. I mean, there were homeless people, but it wasn't as pervasive as it is now. So you saw that number of 9,000. That was 9,000 people that we could see. That doesn't count the folks that are really good at finding recycling dumpsters or really good at camping in the parks. I think if we were to be honest, that number should be at least triple as far as the number of homeless people. And then when you look at the young people and what proportion of that they are, I would guess it's somewhere between 1/5 and 1/4 based on the Count Us In data that we have. So it's a real epidemic, and the question is, why now? Why did I not have the same experience as you guys when I was in my 20s of homeless people everywhere? It has a lot to do with our housing policy. Up until the 80s, our federal government was responsible for providing housing for people in poverty. They got out of that business. They contracted it out. They sold those units. And so we no longer provide housing to the extent that we used to. And the other thing that has happened is we've really turned housing into a commodity, right? It's very much market-driven. So we have enough housing for everybody who's homeless, but if they don't have money, does that make sense? So for every man, woman, and child in this country who is homeless, there are 20 empty housing units, according to the U.S. Department of Housing and Urban Development. Okay, so 20 empty housing units for every homeless person. You know, they could bebop and go to a different place each day of the month, pretty much, right? But those are not units that are within their income bracket. So what we're doing is we're developing units that are much higher end than what people can afford. So, for example, in King County, if any of you in the room are at 30% of the average median income or lower, for every housing unit that you look at that's within your price range, there are 260 households competing for that unit. So you're at a huge disadvantage to get that one cheap apartment compared to somebody who's like at 80% average median income, right? Those guys have their pick of the whole gamut of really nice units. So that is kind of the situation that we've created and why why homelessness is becoming such an epidemic in our country. And, 20 years ago, we were all told, well, it's their fault. They're lazy, they don't work, there's something wrong with them, they're really addicted. And yes, mental illness and addiction are issues in the homeless community, but more and more of the data is showing that those are disorders and problems that will happen after the person becomes unhoused, that their life starts to fall apart without housing. And so health is a really important thing, because basically what I've noticed is the people who are willing to invest in their physical well-being are the ones that are also more likely to want to look good for that job interview, more likely to care about their appearance, more likely to be thinking about the future, right? That's when they've given up that they even have a future, that they've given up on having teeth. When they've given up on even someday having a place of their own, that they've given up on having a shower every day. And so the type of hygiene and just basic privilege around self-care is such a gift that you guys offer. And it's funny, those of us who've had that all of our lives don't really think of it as a privilege. But again, I put you back in that situation where you are treated like crap, nobody makes eye contact with you on the sidewalk. You don't even have a place to go to the bathroom without the police giving you an infraction for public exposure, right? And so thinking about your dental care really is not going to be high on your list. And so that's why your guys' service is so important and such a big gift. So with that, I'd like to open it up to questions. You have me for another 15 minutes. And I've been working with homeless folks for a long time, so things that I've talked about or even haven't talked about, I would love to try out with you.
So where's that line that you draw when people come into Roots where you want to be, stern enough to apply rules, but at the same time have that compassion to, they don't want them to take it seriously, but at the same time you want to be
Right.
stern.
I call it compassionate accountability. If I treat you like you have no agency, then I'm a total pushover, right? Oh, well, it's not your fault, you poor little thing. You've been abused since you were 13. Oh, I'm so sorry, right? That does not work. Number one, these guys are old enough to figure out where their actions impact people around them. But often they haven't lived in healthy homes that show that to them. They've just lived in places where they're abused. So we have to say, okay, so you left a big mess last night, and so before you get shelter tonight, you got to do some cleaning for us. Go clean out the 2 sinks in the kitchen. And they give us flack, and they're like, what? No, it wasn't my mess, it was somebody's mess. Yep, well, our notes say it was your mess, it was your bunk, it was your stuff, and so 2 sinks, or you don't have to stay here tonight, it's up to you. And so we try to keep it out of us versus them, and just say, well, this is what we know, and this is the consequence. If you want to own up to the consequence, great. If not, no harm, no foul. You just don't have to stay here tonight. So we are basically using the power imbalance of being the provider of the service to say this is the way it's going to be, without trying to attach shame or blame or it being all about making them wrong. There's another opportunity to learn. Yeah, I know it sucks, but that's the way it is at Roots. And it's hard. A 45-person sleepover is kind of like Youth Hostel meets Rocky Horror Picture Show. It's, we have constant chaos. And sometimes, most times it all works out, and sometimes it gets a little scary. Any other questions?
So you mentioned you have 45 spots. So how does it work to even get into Roots in the first place? And what happens to the, youth who don't get into Roots?
Good question. So 45 spots is not enough. I estimate as of tonight there are probably 800 to 900 people between 18 and 25 who need shelter in King County. And Roots is the largest. We provide 45. The other 2 provide 20 and 15, one in Redmond, one in downtown. So basically, depending on how you do the math, what is that, 15-20% of those who need shelter get it? So there's a lot of competition for those spots. So what happens is people will call our phone number or knock on our door between 8 p.m. and 8:30 on the night that they need shelter. We will make a list of those names. Once those names get bigger than 45, we do what we call the lotto. And it really is kind of like the scary book where, if your name comes out of the bucket, it's a bad thing, right? So we call out those numbers, match them to the name, and say, sorry, you didn't get in tonight. We will give you a bus token and a hot meal and a blanket. We will try to get you into another shelter The young people typically do not want to go to the adult shelters, even if we can get them in. They just don't feel safe there. Often what I hear is that they will sleep outside. So once those 45 are in, we get them hooked up with their bedding. They have access to showers, laundry, dinner, case management, computers. Lights are out at 10:30, and then back on in the morning at 7. Everybody has breakfast, and they're at the door by 8 a.m. Other questions?
So what do you do during those 12 hours between 8 a.m. and 8 p.m.?
So the shelter itself, we rent out the hygiene area so that people can continue to take showers, access bathrooms, brush their teeth. And that program is run through the urban rest stop 4 days a week. But other than that, it's mostly folks like me who work for Roots and are out there talking to you all, raising money, keeping the doors open. Yeah.
Do you guys actually do anything to help them get out of homelessness?
Yes, we have on-site case management for those who want to use it. What we found is that young people on a national study who access shelter are 3 times more likely to find housing than those who do not. So in other words, they're putting up with rules and structure because they're moving places. We found that same thing by comparing the numbers from the case managers when they're at Roots from the numbers of the same case managers when they're not at Roots. People that they find at Roots, again, 3 times more likely to find housing. So we make sure that there's as many of those opportunities and connections as possible. We also created a recent jobs program. So I don't know if any of you have seen these guys out in the alley, painting out graffiti, picking up trash. And that's actually a cadre of homeless youth who've been hired to do really discussion work for 3 months because there's a good job waiting at the end of that internship. Yeah.
The documents say right now, are there any incentives for businesses to hire homeless?
No, that would be great. She asked about incentives to hire homeless people as an employer. We do have that for vets, which is fabulous. That's really helping with the vet homelessness epidemic. But we do not have it specifically for people who are homeless. And I think one of the difficulties is that the majority of people who are homeless slide in and out of homelessness, right? Even though when we walk down the sidewalk, we can smell and see the really chronic folks, the data shows us that homelessness, by and large, is a temporary condition that folks are like straddling in and out of. Other amazing questions? You guys are great. All right, well, okay, go ahead.
What is the age limit for Roots?
We are 18 to 25.
25. So what happens to, I guess, youth who turn 26?
Yeah, that's a sad day indeed. It happens pretty rarely. Most of our guests are short-time stayers. But when it does happen, we try to hook them up with as many services as we can. Unfortunately, sometimes they are really not interested in those services. Most of the services specifically for young people, they have aged out by the time they're 23 or 24. So, I've got a question for you guys. How many of you guys know about secondary trauma? Oh, come on now. You're going into a field where you're going to be dealing with some pretty scary stuff and you don't know about secondary trauma? All right, well, this is what I've been learning all about because I have amazing young people just like yourselves come into my shelter, volunteer for 6 months, and they get traumatized. They see stuff that they have never seen. They see conflict handled in a way that's physical and loud. They see people whose lives are really at risk. They hear stories about people being raped and arrested for things that are not their fault. And it impacts us, even if we're not the ones physically going through that. Secondary trauma basically means when you start asking those big soul-searching questions like, why is this happening to this person and I'm safe? Why do I have a refrigerator full of food and this person's hungry? You know, those types of things, you have to carry them around on some level. And what we've learned when we've studied, especially health-providing professionals, is that about a third of you will get traumatized by your jobs. Especially the more you're exposed to people who are at risk of poverty, abuse, and oppression. So, and there's no science about who are the ones that are impacted and who are the ones that are not. So my advice to all of you guys is to learn a lot about self-care, like all of the stuff you're doing to survive your programs right now, right? As far as exercise, sleep, good diet, keep those with you as you go into practice. And add a few things that really allow you to explore some of those big questions that come up around poverty, around depression, around how the system perpetuates and sometimes actually makes worse for the people we're trying to serve. Does that bring up any questions for you all? I see a stunned look on a few faces.
Do you have any programs that connect homeless folks with, I don't know, maybe a gym or I don't know, some long
Yeah, we refer some people to the YMCA. There's some scholarship memberships that they can have there. There is a limited number of those. There's also a group that comes in called Street Soccer. That's been fabulous because physical exercise is just really key for people's well-being. I would like to see more programs like that, but again, there's so much trust that needs to be built with the population that you have to be careful about how you do it, especially since a lot of them have been traumatized physically. For example, we do a conflict de-escalation training that's very physical because I need my volunteers very capable in breaking up fights without putting their hands on people. And when the youth come in to help us with the training, sometimes they have to take a big step back because just being in a fake fight is so triggering from their past events that they can't participate. So that comes up a lot in physical exercises. Other questions? All right. Well, I have some information out. I've got our newsletter and I've got some little flyers about ways to help. Those are great as far as you have the opportunity to give us like socks or toothbrushes or whatever, all of the stuff that our guests need are on that list. Okay? All right, well, thank you so much.
I also want to mention two quick things before everyone packs up. One, just with, kind of clinic times and coming late, leaving early, that kind of stuff. We totally understand if you have patients you got to get to, if you want to jump out at 1:15, something like that. Totally understand. Also with coming late, we understand sometimes patients run a little bit longer. Just try and come in quietly and respect our speaker's time. Thanks for coming up.
How do we record our hours for volunteering?
So on that healthandhomelessness.com, it has a little section. It's kind of like a catalyst quiz. You click on it and it'll ask you where you did it, when you did it, how long you did it. And you just plug those in.
So that's a one-time thing, you record it,
Until you get 6 hours, yeah. So if you do like 2 3-hour events, just put both events. If you did 1 6-hour event, just put that. If you do 6 1-hour events, you can do that as well.
About 12 half hours.
You can do that. I don't mind seeing you there.
Travel time, count towards the hour.
Try not.